Hello friends, I am Dr. Amit Pankaj Agarwal. I am Director and Head of Joint Replacement and Orthopedics at Fortis Hospital, Shalimar Bagh, New Delhi, India. Knee pain is a very common problem that starts affecting us in middle age and onwards. So there are various causes of knee pain. So first of all, we are going to look into what causes knee pain and what can we do to avoid that knee pain and what can we do if the knee pain becomes unbearable and there is deformity in the knee joints. So first of all, friends, we have this model that I intend to use to explain to you what is knee pain and how it affects the health of the knee joint. So if you look at the knee is formed by two bones. One is the thigh bone, which we call as femur. The other is the shin bone that we call as tibia. And if you look at this bluish structure, which is a very smooth covering that covers the ends of both the bones, which helps in lubrication of the joint, which gives rise to a painless movement in the knee, which is desired. After some time, due to degeneration, or we call it wear and tear of the knee joint, as you see, there can be some erosions or it can become rough and there could be friction in the knee joint, which can start giving you pain and you may have a problem carrying out your day-to-day activities. If this process goes on, then the layer becomes almost completely damaged and the bones become raw and exposed, and they can cause severe pain, and following that the condition becomes even worse. So this is a very common cause of knee pain, and we call this condition as a wear and tear type of arthritis or osteoarthritis. Now, once the condition is in this stage, that is, the bone has become denuded or the bone is exposed, then there is no role of these modalities. If you are fit and you want to pursue your normal life, if you want to enjoy your life and mobility, then the procedure that we recommend is a surgery in which we take care of the denuded or damaged part of this layer, and we use this kind of prosthesis where we apply this cap kind of a thing to the surface of the bone. So this procedure is known as total knee replacement, and there are various techniques of doing the procedure, and there are various advances that have taken place in the last decade in this field. And what we do is the most advanced type of knee replacement procedure, which we call enhanced recovery knee replacement or fast track knee replacement. So in the fast track pathway, the patients are operated in the morning, and in the afternoon they are able to take a couple of steps with the help of a walker. This procedure is almost pain-free in more than 90% of the patients. And the another advances that we use is what we call as blood reduction modalities, where various drugs and other things are used to reduce the blood loss, and we have been able to reduce the requirement of blood transfusion in our patients to almost less than 1%. Another aspect of fast track knee replacement program is that it is what we give to our patient is a stitchless surgery. The advantages of giving stitchless surgery to the patient is that the patients don't require to come back for suture removal. They are able to take bath, say, after 3 to 4 days of surgery, and the irritation that is associated with staples is also little lesser, and the chances of superficial infection also goes down. So with the help of fast track pathway, the patients are able to walk the same day. They are able to do their stair climbing and other activities much faster than the conventional knee replacement. And we use computer navigation. The latest software that we use is called Knee 3 software, which gives us the more precise alignment of the prosthesis, the soft tissue balancing, which are very important to give a long lasting knee replacement. It helps a great deal to give a very good soft tissue balancing so that your knee is stable, it has the full range of movement, and it is properly aligned so that the life of knee replacement would be as long as possible. If your knee joint is damaged to an extent that you are having problem in your day-to-day life and you are in the age group of say 55 and onwards, then there is no point in delaying your surgery, because if you are crippled and you cannot enjoy your life and mobility, then there is no point in delaying the surgery, because with the help of surgery you can go back to your life, you can enjoy your activities, and we always say that mobility is life, that is, movement is life. If you can't move to the extent that your body requires, then the body starts to have other complications, like you can have other lifestyle diseases, heart diseases, you can have diabetes, which can become worse if you don't walk. So walking is very important, and recreation is also very important. So you have to think and you have to go past that block in your mind that you should delay the surgery indefinitely, because it's not going to help. If your doctor tells you that your disease is in advanced stage and you are in that age bracket where no other thing is going to work, you should not delay your surgery. If we look at the literature, in terms of giving back the mobility is close to 99%. There are chances of some complications, but if we observe all the precautions of asepsis, the chances of infections in centers which follow the standard practices of infection control are less than 0.1%. And the life of these surgeries, if they are done well and they are properly aligned, is close to 25 years in more than 90% of the patients. Thank you.